Hi everyone, my name is Nadia Maxwell and I am a dietitian and I am here to chat to you a little bit about the nervous system. So I thought I would record this quick 10-minute video to talk to you about this very hot topic, and it's a hot topic for a good reason. The nervous system is really relevant for everyone, but especially for people who experience pain and or other symptoms like gut symptoms. Now, it's a topic I talk to my clients about a lot, and I'm sure many other clinicians in this clinic also talk to their clients about because it is relevant across all disciplines. Now, some of you might already have quite a good understanding about the nervous system, whereas others might not have much of an idea. So I'm going to talk through it just to lay the very foundations. I'm going to talk through the very basics. And I personally like to draw on something called the polyvagal theory, which is what I use a lot to help lay those foundations and have an understanding of the autonomic nervous system. Now, as mentioned, I'm a dietitian, so my lens is a little bit more relevant to eating and symptoms, particularly gut symptoms. But other members on your team might have a slightly different lens. So just take whatever feels resonant to you. And if you want to build on these foundations, you can absolutely ask your healthcare providers for individualized support on the topic of the nervous system and how to actually apply it to your life. Now, I'm a big nerd, so this is going to feel a bit like a biology session. So please bear with me. I'm also a visual person. So what I'm going to do is I'm going to share my screen now and talk you through it visually. So this here is a depiction of the autonomic nervous system. And over on the left-hand side, you'll see a level of arousal. So hyper, optimal, and hypo. Now, most people are familiar with the terminology fight or flight. Now, that's when we're in hyperarousal and our sympathetic branch of our nervous system is activated. Now, how our body tends to communicate in this state is tense, anxious, my breathing rate increases, my heartbeat increases, I can feel a bit trembly, shaky, breathless, and a bit panicky. Are you familiar with this state? And then we've got our hypoarousal. Now, this is our parasympathetic dorsal vagal pathway. This is actually our most ancient evolutionarily. So I often think of an animal playing dead. So that's that we become so overwhelmed that we might freeze and shut down. So this is commonly referred to as freeze and fawn, overwhelm, shut down, sometimes foggy, fatigued. And how our body tends to communicate in this state is a bit more of that confusion, maybe flat, maybe heavy, shame, dull, despair. Our heart rate might slow and we might feel quite like numb or spaced out. I'm not present. Are you familiar with this state? Then I usually like to get a gauge with my clients as to where do you spend more of your time if you're outside of the middle? Is it more up or is it more down? So, for example, I'm more of an up person. I can definitely drop, but my instinct is up. So I get curious, where are you spending more of your time if you're in one of those? And where also do you spend time when, say, you're, for example, experiencing pain? So a lot of my clients might drop with the pain. So getting to kind of know our own systems can be really helpful. And then we've got the middle, the optimal arousal. Now, this is our parasympathetic ventral vagal pathway. If you hear people talking about the vagus nerve or vagal tone, they're often talking about how do we spend more time in the safe and social rest and digest. I'll often refer to something called the window of tolerance, which is a concept by a psychiatrist called Dr. Dan Siegel. And it's almost like we can picture that we all have this window. And it's when we're in our window, that's when we can feel, connected, grounded, present, open, playful, socializing's a lot easier. We might feel more relaxed and our breathing more paced. Now, I always say it would be nice to be here all the time, but that's also not realistic, right? We develop these other areas for a reason. Now, um, everyone's window is going to be a different size, right? And it can actually change in size as well. Like I know if I'm pre-period, my window shrinks and I'm much more likely to get irritable, for example, or when I'm sick, or maybe I've had a really hard day. I can get triggered a lot more easily. So that size can change. And I guess what the goal is more so to expand our windows. So perhaps things that used to trigger us out no longer do so as much, but also it's actually about the flexibility to move rather than getting stuck. So, for example, if we can notice in our own nervous systems when we're out or heading out, then we can hopefully build the skills to bring ourselves back into our window. Now, that's where I ask my clients, do you spend much time in this space? And I get different responses. Some people are like, yeah, and others are like, no, I really don't. And that isn't actually uncommon. And so that's where I refer to something called the faux window. And that's where we can be just outside our window. You know, we can pretend we're fine. People might think we're fine, but we're not actually grounded. And so, what I often say is, we don't actually necessarily want to normalize this. We want to actually know what it feels like to be in the middle. And once again, build on those skills and that flexibility of our nervous system. Now, why I talk about this as a dietitian is that it connects to eating in a few different ways, and I will just speed through them because it may or may not be relevant for people here. But the first one, and I talk about this one in my presentation on nutrition for pelvic pain and endometriosis, and that is that if we're going for very long periods of time without eating, our blood sugars drop low, our body sees that as dangerous. It goes, uh-oh, that's not good. And so it'll essentially send us this surge in adrenaline or stress hormones to help mobilize us, to help us go find food. But depending on how connected we are with our appetite cues, we might actually just perceive that as everyone's annoying me, right? That's fight energy. Or I'm too busy, I've got too much to do, I can't slow down, I can't stop to eat, right? And what we often notice is that when we eat something, actually we feel a lot better. So that's why I'm always talking about trying not to go for too long without eating or have really inconsistent intake because it kind of turns us up a notch into that hyper arousal. So it's very hard to get grounded in that case. So that's the first reason. The second is sometimes we do some emotional eating, and that is actually really normal. We think of a baby. So a baby who's upset maybe gets the bottle or the breast, and often they'll whimper and calm down. You can always see them coming back into their window with food, with nutrition. And of course, there's an element of attachment there, but it's also to do with eating and what food can do for our neurotransmitters and our brain chemistry. But also the action of chewing and sucking helps with our vagus nerve and vagal tone. And that's kind of why dummies work for babies, right? That sucking can be really grounding and bring us into our window as well. So I always like to normalize that. I hate it when people demonize emotional eating, right? But I guess what I say is we want a fuller toolbox. If food and eating's the only way we know how to soothe our nervous system, that's when it might become an issue. So we just want a fuller toolbox of things that we can use to self-soothe. And there are a couple of other ways eating is connected to the nervous system, but I'll leave off that for now and I'll actually go down to how else does this show up in our body? What are we looking for? So when we're looking at fight, we might notice things like maybe a knot in our stomach, biting our nails, pressure behind the eyes or forehead, clenching my jaw, my muscles are tight, low appetite, and maybe struggling with sleep. Flight is a bit more like restless legs. I've got this sense of impending doom. My anxiety's up. Maybe this inability to settle or sit still. I'm a bit fidgety, jumpy, hard to stay on task. Yeah, maybe struggling with memory. So tune in as to whether any of those are maybe relevant for you. And then down in freeze and form, it might be more of this kind of that spaced out, disconnected, dissociated, maybe disconnected from our internal environment, but maybe our external environment as well, and our emotions. Maybe there's kind of more of that shutdown, breathing's quite shallow, sluggish. Some people might describe it as bored or maybe low or depressed, maybe struggling with memory as well, and kind of more of that, bit more of that flop. Now, I see these ones as a bit more of the whispers. These are our body saying, hello, you're dysregulated. Please do something about it. Whereas when we get stuck here for long periods of time, sometimes our body can speak more in screams. So these can be things like pain, maybe that pain that used to maybe be localized to one area or wasn't as intense, maybe kind of feels like it spreads, or maybe we start to anticipate it, or something that used to be not as painful is way more painful now without reasons that we know of for sure. It can be things like nausea, gut symptoms, and this intense fatigue. So I'm like exhausted, but my mind won't stop. And then down, freeze, and fawn, it's kind of can be this kind of chronic fatigue picture, like waking unrefreshed, once again pain, once again gut symptoms, and once again this intense fatigue, but this is more of that tired and my mind moving slow. Now, I like to be very clear that pain and other symptoms and conditions are complex and multifaceted. So, nervous system is one component, absolutely, but we also know that there can be other components. So, for example, in the case of endometriosis, we know that the immune system's involved, and we know that the hormonal system's involved as well. And I just like to highlight this one because this is an area that once we know where we are in our nervous system and we build those tools, it's an area that we can have a lot of control over. Some control over. Now, so that's where ideally we're not getting stuck out here. Once again, it comes back to that flexibility. And that's where I'll often ask my clients, what things do you find bring you into your window? So it might bring you kind of down or might lift you up, right? And that's where I get a sense of what's in people's toolboxes. Some people have very lovely full toolboxes with lots of strategies, and some people don't have many. And that's where we would just work together one-on-one with myself or your psychologist or your pain physician or your GP or whoever your clinician is to help build up that toolboxes of things that help you feel more regulated more of the time. And I always like to talk about having a real variety of tools. For example, I know that walking can be a helpful one for me, but if I'm way out here or I'm way down here, there's no chance I'm going for a walk. There's no chance I'm going to the gym. So I also want the things that actually I can do when I'm very dysregulated. So that's the playing with my pet, or having a cup of tea, or watching a funny video. And those are the things that might bring me in just enough to then go do the things that bring me in further. So that's another angle and lens to come at it from. And yeah, essentially that's it. It's kind of like a two-step process. So like asking yourself, where am I in my nervous system, and kind of getting an awareness. And so I would love for you over the next couple of weeks just to check in with where you are throughout the day. And then the second step is, what do I need? So where am I and what do I need? And even if you just start with that first step, where am I, and get that sense, that is a beautiful place to start. And hopefully you might have some ideas of what you might need in future, or maybe that's something you might want to work with your healthcare provider on. Okay, so I hope that helps to lay the foundations of the nervous system. Please reach out to me if you have any questions, and happy tuning into your nervous system.